Somatic exercises are movements that tap into your mind-body connection and help relieve pain, stress, and trauma within the body. In this video, we're going to look at what some examples of somatic exercises actually are, and then we're going to talk about how the heck they actually work within the body and why they are effective. I experienced over 10 years of severe chronic illness, and somatic exercises were something that I personally use in order to fully heal myself. Somatic is a connection to the body. Exercise is an activity, movement, or practice which can be physical and or mental. Common practices that use somatic exercises are yoga, tai chi, and qigong. When we move and stretch our body, we're physically moving stagnation from our cells and tissues within our body. To understand how and why this works, let's briefly discuss the fascia and how we can use this tissue to work for us instead of against us. Fascia is connective tissue that surrounds all cells, nerves, joints, and organs in your body. It has nerves that make it almost as sensitive as your skin. Healthy fascia is smooth, slippery, flexible, and easy to move. However, fascia can become thick, tight, dry, and sticky, making it hard for mobility, hard for our joints to move, hard for our organs, harder for our organs to work. This can be caused by injury, surgery, over movement of certain joints or parts in the body, or stagnation, not enough movement. Some people even say that the fascia is the subconscious physical form in the body. It's something that actually used to get thrown away during surgery, and kind of like, what is this like saran wrap like material over all of these parts of our body? But now it's being looked at as way more than that. Now, how do our thoughts become physical things within our body, creating this somatic experience that we're having? Our thoughts are an etherical thing that is not physical. They go through our neural pathways in our brain, become electricity, sending signals to the glands within our system throughout our nervous system to our glands. So our glands produce hormones, which becomes the physical chemical that now is a physical representation of our thoughts. So our thoughts go through our neural pathways, go into our nervous system, to our glands, telling our glands to do something, to either produce stress hormones, to produce relaxation hormones, essentially either putting our body into sympathetic fight or flight or into parasympathetic rest and digest. Our thoughts become energy in motion, or emotion. So in these somatic exercises, we are physically moving the fascia within our body. When we talk about like knots in our muscles, it's actually the fascia bunching up over the muscle and pinching onto it. So when we talk about stagnation within our tissues of our body, we're talking about the fascia knotting up around muscles, around organs, around our intestines. And when that happens, it's literally holding on to that part of the body, and it's not allowing free-flowing lymph or blood flow or connectivity through the nervous system to happen. We also have physical memory cells throughout our entire nervous system. Brain cells that hold on to memory reside within our entire body, our entire nervous system. So when we release that fascia and we allow it to go, we're not only releasing the physical whatever we're holding on into the body through hormones, through toxins that came into our body that day, so anything we ate, drank, smelled, tasted that day, but we're also allowing the nervous system to release from that area. So we might be in a yoga class, in a yin yoga class especially, and we start crying. We start like experiencing feelings from something that happened because we released the trauma that was physically being held within the nervous system, physically being held within the cell. It's getting trapped in there. So instead of experiencing something and just letting it go, letting it move through our system, we're actually holding on to that in this one part of the body. When we first start moving after a time of stagnation, whether that's from illness, whether that's after an injury, after a surgery, or we just had like a moment in life where things were just really hard and we just weren't as active as we had been before, it can feel like a lot for multiple reasons. You know, our muscles haven't been as active as they were before, but also we're moving so much that has been stuck within our physical cells of our body, and that fascia is moving and stretching and releasing now, so we can actually start to let that stuff go. And this is the magic of the mind-body connection and why somatic exercises are so important to our overall health. Just any kind of movements in general can really help to release on a regular basis. So now you know what a somatic exercise is, some examples of practices that use them, how the fascia works within our system, the nervous system, and the mind-body connection, how it all plays a role together. If you're interested in learning more about how you can utilize somatic exercises and what some follow-along examples are, head over to the videos down in the description below. Thanks for joining me. Leave a comment if you've been practicing somatic exercises yourself, and make sure to like this video if it's content that has helped you in some way, and subscribe if you're not subscribed yet so you can get notified when more videos like this come out. All right, see you in the next video. Bye.